When I came to see Dr. McAllister at the Advanced Bone and Joint Center, he told me that in order to get my surgery, I had to lose weight. So he gave me several suggestions, one of them being the ideal plan. So that day I was so desperate because I was so ready to have this done and couldn't believe that yet another delay, because I've been diagnosed with diabetes and a whole lot of other health issues that had postponed and postponed and postponed everything I wanted to do. So I remember walking in, I called my husband that day and I said, look, I'm going to try this. I said, I need your support. So she talked about expectations and the plan and the fact that, you know, I didn't have to worry about creating food for 3 of my snacks a day, and then I just had one regular meal so I could still have some of the food I'd like. The first week I actually lost weight. That would have been the first time in the last 5 or 10 diets that I'd done that I actually lost weight. My husband was a rock star. Not a compulsive eater as much as I am, but he's married to one, so if you're married to one, you're going to gain weight. So we both had a lot of weight to lose. We didn't focus on, I have 65 pounds, I've got 90 pounds to lose. We focused on, how am I doing from week to week? Delia was here with food suggestions, and Jack did it darn near perfectly. I mean, I've never seen anybody that just decided, okay, this is what I'm going to change and I'm changing it. I, on the other hand, not as good as he was. But even on the weeks I didn't do well, she always found something that we could be proud of, whether it was visceral fat had gone down, you know, I hadn't eaten that 4th helping of whatever. There was always something to rejoice about and always something to learn. And then, of course, we started getting the emails through the mail that, you know, those little spokespersons would come on and talk about the plan and how to do it. And we got a disc that we could take home and watch when we wanted to. And the food was good. I've been on lots of different places where they sold you lots of different food, and it was almost like cheating, because I have my little chocolate bars in the morning and I have my cheddar ridges for lunch, and it doesn't feel like I'm on a plan. It feels like I'm eating the food that I'm not supposed to eat, but it's okay. So that's probably been the biggest surprise of all with it, is the food is really pretty good, and it literally, and then when I eat my normal dinner at night, I've already had my snacks through the day because I've had my little chocolate bar and I've had my little, you know, barbecue chips or whatever it is that I wanted that day. So we have been on the plan. We started in February. I had lost 55 pounds by June and qualified for my first knee replacement surgery. Jack lost 65 pounds by that time. The most surprising part is that I could come to my orthopedist and he could offer me a solution that actually worked. And I think that was the greatest part, because I'd been to so many that didn't. So yeah, I'd do this again in a second. And I'm so glad I came to see Dr. McAllister, who introduced me to the ideal plan. And yeah, we're sold on it.